Is the public option an effective way to transition to single payer? You talked about, well, you don't want to patch up a broken thing, or you can only get so far with these patches. Is the public option a worthy patch?
Well, I worry about the public option. It might do some good, but I think a lot of it, of that good, is coupled with the fact that it's likely to become really a high risk, low profit pool that helps the other insurers out. We've seen that in the Medicare program, where we have the traditional Medicare program, which is a public option that competes alongside of private Medicare Advantage plans, where government will pay your premium if you want to switch to those plans. And what's happened is the low-cost, profitable patients have been enticed into switching to those plans. And once you get sick, the plans make it uncomfortable for you to stay. They have enormously high copayments for cancer drugs. They don't give you home care when you need it. And they say, they implicitly go back to the Medicare, traditional Medicare, the public option, when you're unprofitable. And the estimate from the official agencies that look into this is having the private plans competing with traditional Medicare has driven up Medicare's cost by about $1,000 per person. So I fear that a public option becomes almost a way to subsidize the private insurance plans by taking the unprofitable patients off their hands. So if it gets some people coverage, I'm all for it. I don't think it's a way to take a step towards single payer. I fear it's not, because it ends up as a high risk, low profit sidelight.
That's a really profound point that I don't know a lot of people have spent a lot of time thinking about, which is, if you do the public option, and to your point, if all the private insurance companies kind of like push their most expensive patients to the public option, because frankly, if I were a health insurance company, that's what I would do, just because of the numbers, right? Then what will happen is a few years later, when the next round of legislation comes up to discuss single payer, the argument will be, look, Medicare is a mess. Medicare is extremely inefficient. Their cost per patient is way higher than the free enterprise market insurance. And that's example of why it really is the USPS, and it's like Amtrak, and it's trash. And it will be important for as many of us as possible. It's kind of like the counting of the ballots. Like, we all saw that the mail-in was going to get counted later, and we knew the chart was going to look like Trump won early and then Biden would catch up, and we knew people were going to say it was stolen. And some of us were talking about this for months and months. This is another debate that, if we put on our Nerdstradamus hat, which is, if we have a public option, I guarantee you 2-3 years later, the Republicans will say, see, that public option is so expensive, and we're going to have to explain, well, that's because the private insurance companies dumped their most expensive patients into the public option to protect their bottom line. It's not because the public option in and of itself is somehow terrible. But that's a hard thing to explain in kind of the age of Twitter and bumper stickers.
No, you're absolutely right, and I like the way you've put it. I haven't made the argument that way, and I'll learn something from you.
Well, I appreciate you bringing it up, because it's such an important point. Here's the next question from the audience. Someone was asking, hey, why are people being charged for COVID tests if testing is supposed to be free? I've heard this a lot. My kids, their school requires them to get tested weekly, but I pay for them out of my pocket for it. And I'm wondering, why aren't there just free COVID tests for everyone?
Well, there should be, but there aren't, because the laws that have been made say that they only need to be covered when it's, quote, medically necessary, and the insurance companies have decided what's medically necessary and what's not. And as I think I said before, the test itself might be covered, but the cost of getting the sample may not be covered. So once the sample is in the lab, that cost might be covered, but the cost of having a nurse or a doctor actually obtain the sample, that's a separate question.
Yeah, got it. Laura has another question is like, well, what if you just have strict government regulation of costs, but you keep the private health insurers? Any thoughts on that as an approach?
Yeah. Well, there are several countries that basically do that. They have incredibly stringent regulations of private insurers. Switzerland, Germany are like that. But their insurance companies are really unrecognizable for people who are used to ours. So in Germany, they've got dozens of different insurance companies. They all pay exactly the same rates. They all are required to contract with every doctor, every hospital in the country. If one insurance company accumulates too many high-cost patients, they get subsidies from the companies that have fewer high-cost patients, and the government oversees the whole system. But that's a system that's in some ways as different from our private insurers as a national health insurance program would be. We've studied those things a little bit as well. They're not as administratively efficient as going to a single public insurance plan. Germany has that kind of system because they started down that road in about 1890 and evolved to that system. But it works pretty well there. They're willing to spend, it would be something like an extra $100 or $200 billion over what a fully efficient public insurance system would cost. But as I say, it's nothing like our private insurance plans in this country. In fact, in Germany, all the health insurers in that system are required to be nonprofit, and their boards are made up half of employer representatives and half of union representatives. So imagine taking, Cigna or Aetna and saying to them, by the way, you're going to be nonprofit starting tomorrow, and half your board is going to be union people and half are going to be employers, not the boards that you have today. So you could construct a system that might work using that. I don't think it's any easier than moving to a Medicare for all.
I just want to thank some of the members of this channel who make this content possible. So if you find this useful, please remember to like and share. And if you are not a subscriber, come join the family. And then if you really want to help keep this channel going, because now that the election's over, probably not going to have as huge audiences as we did the day after the election, which was nuts. But consider becoming a member. You can just hit the join link on YouTube. And here are the people who have already done that. So let's start with the highest level. At the EVP level, we have Kristen Slevin. So thank you, Kristen, for your support. And then we have at the VP level, we have Mindful Skeptics, which is Boyce, Laura Lane, Patrick Dunn, Joshua Frick, Fat Lamb, VLAM, and JM Sapp. Thank you, guys. You guys have been with us a long time. Boyce is a recent VP. So welcome to the VP level, Boyce. Mindful Skeptics. So then we have Hardcore, which is the next level. And we have some new members, Stat Nerd and Dean L. and Robert Wu. And then some long timers, Yang Deng, Susan, Mona, Landline, Mr. History, Byram, Jekalego, Kirsch, Phoenix Congress, not DK Metcalf, Tracy, David, Gene, and Mike. And then at the entry level, which is only $1.99 per month, I think, Verified Nerd, we've got Ira, Miles, Hui, Nell, Stephen, Brad, Jalopy, Aaron, Emma, Brenda, Anna, Joel, Spirited, KM, Bike, James, Blair, Jessica, Ryan, Rasta, Tony, Vaughn, Elizabeth, Christina, Lisa, Shake and Make, Doris, Nell, Mike, Gail, Richard, Roger, Ben, Lori, Soldier, Emerald, Jadwiga, Sophia, Hitachi, your mom, your mom. Peter, Arez, Sugar, Albert, Brandon, Yes, Brian, Helen, and Lisa. So thank you to all the members who make this channel possible. All of the money does not go to my glamorous lifestyle. It goes to supporting the content like our podcast hosting fees, the streaming software I'm using right now, also like some design costs for our merch. And then going forward, if I can save up enough, we also did a big ad campaign on Yang Speaks to promote the channel. And we'll be doing future ad campaigns, basically grow the audience. The bigger audience we can get, we can attract even higher profile guests for our one-on-one interviews. And also it helps us support the candidates in the 2022 and 2024 cycle because we'll have a bigger audience and can channel more energy in their direction.